Are family carers up to the task? Can they provide good care? Can they cope? This book, Minding the Elders, also published in 2006, it says family carers are torn between love and exhaustion, dedication and guilt. They want to do their best. When they fail, they feel guilty about themselves. This 36-hour day is widely regarded as the Bible of dementia caregiving. It's a 36-hour day, more than 24 hours a day. And so, if I may quote from a poem by this lady, Jodi Mishan, she says she's a caregiver to her father. Actually, her father has passed away. She says, are we caregivers all nerds, totally absorbed in one thing, isolated from the world, no social life? I will skip the rest in the interest of time. Hello, my name is Jodi. I'm a caregiver and I'm a nerd. And I no longer have control of my life. Is this not very sad for her? What are the effects of caregiving on the family carer? Increasing commitment of time. Social effects like social isolation, role changes, role strains, competing demands. She not only has to care for her father, maybe she has to look after the interests of her husband who needs her. What about her children? Psychological stress. There's data to show us that family caregivers have much depression. They have physical problems like lowered immune function, at higher risk of health problems like hypertension, and of course financial problems. And I'll talk a bit more about that. So what do? We help family caregivers help themselves. We help them so that they can help the person with dementia. What has research shown in respect of effective caregiver intervention? I think the research, I've based my information on two systematic analyses which have built into them meta-analysis as well. And it has shown that actually for caregiver intervention to be effective, first it should be multi-component. You must offer different things for different people. Education and skills training, emotional support in the form of counseling, family therapy, even cognitive behavioral therapy, and respite care. They need rest. You need to give them some space and time for themselves. Now, these interventions need to be individualized. The omnibus approach says that basically you need to have an array of interventions for them. You help them pick and choose what's appropriate for their situation. So individualize them. And lastly, the most important aspect is that it has to be responsive, continuous, and ongoing. Meaning that when they need help, when they need to have somebody they can approach immediately, some kind of helpline, some hotline. They can talk to you. Maybe the problem can be settled over the phone, but maybe you need to admit them. There are ongoing studies that combine psychosocial interventions with drug. And this is really what we do in real life, in clinical practice. Will there be a synergistic effect? Probably, right? And lastly, dementia is not just a medical problem, it's a societal problem. Therefore, psychosocial factors are important. Dr. Chong and Prof. Saku already mentioned this just now. The statistics of dementia are telling. Approach to dementia cannot be then from purely a healthcare point of view. The collective conscience of society must adapt to the needs of this growing segment of society. This was published, this came out in the new paper, I think about 2 years ago. It says, the silent epidemic, are we prepared for the onslaught of dementia as our population ages? And then this more recently, in March 2007, Singapore may face burden of 50,000 Alzheimer's patients by 2020. Are we ready for the dementia time bomb? Our CPG says the prevalence of dementia is expected to increase from 22,000 to almost 53,000 and 180,000 in 2050. And this is really based on this Asia-Pacific report on dementia. The epidemic is here, commissioned by Alzheimer's Disease International, just released on World Alzheimer's Day 2006. And so in response to this, Minister Lim Boon Heng was actually asked, what's the government's approach to this? He says, Singapore will have to cope its own way. And dementia is a mental health issue with social implications. What are the social implications? How bad is this impact? 22,000 compared to 24 million in the world now? Might be a very small figure. But if I tell you that there are just 50 nursing homes in Singapore offering 6,500 beds in total, you immediately see the problem. 22,000, 50,000, 180,000. How are we going to care for them? And we know we have an aging society. So what does this mean? Build more nursing homes, institutionalize them, but don't we want aging in place? Develop more community care so that we can keep them at home, so that they feel better, more comfortable, have a better quality of life. more daycares, train maids who provide good care, pay willing family members to care for their elderly at home? I don't know. The worldwide cost of dementia is estimated to be $250 billion. If you compare this to diabetes, if you believe the research by Anders Wilmer and Ben Winblad, then they say that diabetes in comparison is only $150 billion. It costs the world a lot less to care for people with diabetes. Why is that so? Isn't diabetes a more prevalent disease? Well, Prof. Sakku has already said in his foreword, he says it's estimated that 44% of total cost of dementia care is due to informal care. It's due to family caregivers having to quit their job or work part-time just to care for a parent with dementia. This slide was actually given to me, not given to me, but it was presented by a family caregiver during one of our caregiver support group sessions. I borrowed this slide to bring across this point. Dementia care is expensive for the family. The drugs cost on the average $150 a month. At that age, 70, 80 years old, they have heart problems, diabetes, etc. Maybe another $50 for other medications. You pay for a maid, another $700, $800. You want to provide good care because the maid cannot provide good quality care and they cannot play mahjong with your family member with dementia. You put them in the daycare, it's another few $100s. Just because your relative has been diagnosed with dementia, if you want to provide good care, it's easily more than $1,000 a month. What's the average household income for Singaporeans? $4,000. How many people in Singapore can afford more than $1,000 to care for a family member with dementia? And so the family carer asks, what are my priorities in life? I'm a son and daughter. At the same time, I'm a husband and wife to my spouse. At the same time, I'm a mother and father to my children. I have my career, my ambitions, my life, my own dreams. Now my relative has dementia. How do I keep the balance right? And so in the same way, we must ask ourselves, I think, what are our priorities as a society? Do we just want to provide quality care? Do we want to provide quality care or just want to provide very basic care to keep the old person clean, fed, and sheltered? Or do we want to do more? We know quality dementia care is expensive. It's very unlikely to be profit-making. Fourth age care is unlikely to be profit-making. Organizations' bottom lines may be very difficult to meet. The story of a person with dementia is much more than can be explained by what is going on in brain cells. Back in 1997, Tom Kitwood already told us, it's a story of a tragic inadequacy in our culture, our economy, our traditional values about gender, our medical system, and our general way of life. Maybe our value system is just not compatible with looking after people with dementia. And so that same book I alluded to just now, in the commentary, it says, MacLean conceptualizes dementia care as a moral enterprise. She encourages innovative and compassionate elder care and accountability across the spectrum, from direct caregivers to nursing home owners to those at the highest levels of government. Is it a moral enterprise? Or is it more? Is dementia care a call to love? In my mother's case, I've gone beyond a mother-son relationship. I used to believe that you take care of your mother because of obligation as a son. But that's only gratitude. In my painful journey with her, I think I finally understood what it means to love. Can there be love without pain? Can there be love without sacrifice? Are we as a society asked to sacrifice something to care for this group of people? And so the future depends on us, isn't it? As individuals, as families, as a people, as a nation, as a civilization, as a human race. Peter Whitehouse, one of the a neurologist who is one of the pioneers in dementia care, who's gone more into the psychosocial and ethical issues of dementia, says the ethical issues surrounding so-called dementia are critical to the survival of our species. Ironically, but not unexpectedly, the dementias will provide true tests of whether the human community can address the future of life on the planet wisely. It is up to us all. What is our response? Before I end, I just want to share with you some words from a person with early dementia, Richard Taylor. We have so far been talking a lot about dementia, but we haven't consulted people with early dementia. What do they have to say to us? Is there something they can teach us? The words may be too small, but maybe if I can read to you. Professionals, especially physicians, do not seem to want to consider our presenting problem. We hurt emotionally. Our fears are consuming us. There is no pill of it. Counselors pass us off to each other because they claim they are unfamiliar with the disease. How many psychologists are trained to counsel people with dementia? Can't we have a conference about us, with us, for us, about the real problems we face From the day we hear the diagnosis, it's great to talk about proteins and nude mice and pills and profits. But what about us, those of us living with the disease? Must you always squeeze us together in a program with no time to explore our issues? We have real problems, real to us, problems which others could help us solve if they would take time to understand each of us. We are worth your time and effort to understand how the disease affects our emotions, our feelings. We need your help to develop better communication models that change as the disease changes our family dynamics and us. Do not give up on my mental health simply because eventually I will end up mute and bent over in a wheelchair waiting to die. Psychosocial research does not have the glitz or profit of pure research, but it sure is needed. It will be needed more next year than this year, and so on and so on. Richard Taylor, before he was diagnosed with dementia, was a professor of psychology, actually. So in conclusion, good dementia care is not just quality medical care. It's more than that. It has to be more holistic. Quality of care depends on the carer. And good holistic dementia care improves outcomes. There's some data, there's more data. The research in psychosocial research methods are improving. There will be more to come. Dementia care is often burdensome, painful and expensive for the family carer and also for the society. Good care is possible, but at a cost. Are we prepared to actually sacrifice? The choice is ours. Thank you.